Right now, there are not enough ICU beds for people who are sick from other things than COVID. So really, you're acting to protect others, not just yourself.
Welcome to our podcast series, Health Calls with Dr. K. During this podcast series, we're going to talk about a lot of different things, but specifically it's about medicine, the human side of medicine. We all have questions about our health, and who can you turn to? The doctors that you trust. Hi, welcome to House Calls with Dr. K. Today we're going to be joined by lead epidemiologist at LA+USC Medical Center, Dr. Paul Holtom. Thank you, Dr. Holtom, for joining us today. It's so great to have you.
Well, it's my pleasure to be here with you.
So let's get into your role in the hospital. You're an epidemiologist. Can you tell us what is epidemiology and what does an epidemiologist do?
Sure. Now, for hospital epidemiology, and there are many types of epidemiology. There are public health people who go out and look at disease in the community. For hospital epidemiologists, which is what we do here, we look at disease transmission in the hospital. And our goal is to look and make sure that everyone is safe. The patients are safe, the staff is safe, the visitors are safe. And so we look what ways can we prevent disease being transmitted from patient to staff, from staff to patient, and if we should unfortunately see that a transmission is happening, how can we intervene? What can we do to protect people? How can we keep people safe?
Great. And so I'm sure this has come up a lot during the pandemic, and we have been asking you left and right about questions, how to keep staff safe, how to keep patients safe. Have you been on speed dial for everybody lately?
It certainly seems that way, but yes, this is, of course, a once-in-a-century event, but at the same time, it is a major event for epidemiology, a contagious disease, bringing lots of people into the hospital, a need to keep everyone as safe as possible while still providing excellent quality care to people.
Well, thank you for everything that you do. I mean, you're guiding the information and the protocols for LA+USC Medical Center in collaboration with our CEO and CMO, Dr. Spellberg, who has also been a guest on the podcast. And the three of you regularly hold town hall meetings. You definitely have a very charismatic and fun partnership on the town halls. Can you tell us a little bit about how you guys interact and what has been termed as a bromance?
Well, sure. It's kind of interesting. Certainly, Dr. Spellberg, I've known Dr. Spellberg for a number of years, since he was at Harbor previously, because he works in infectious disease. And it's been wonderful to have Mr. Orozco here for the past few years as our CEO, and he's just a fantastic person doing a fantastic job. The town halls kind of came about by accident at the beginning of the pandemic, long time ago. Dr. Spellberg and I got together and we just did some informational town halls. That was so long ago, it's so hard to think how long ago it was, that actually we met in person with human beings in a room and talked. Isn't that amazing? That seems so ancient, doesn't it?
Wow. And dinosaurs roam the earth.
That's right. And then Mr. Orozco came to join us to deal with some of the questions that were coming from an operational standpoint and from his perspective as a CEO. And then we ended up coming on, of course, no one could talk anymore in public, and no people could get together in rooms because of concerns of transmission, and so it began. For a while it was going every other week during the beginning of the pandemic, and now we're down to once a week, but it's been a wonderful time. It's a lot of fun, and it's a really great opportunity to answer people's questions. People seem very involved as they type in questions, and to keep everyone updated on what's going on.
But it's really fun, actually, besides the information, which, by the way, is very helpful, and we appreciate everything that the three of you do and the whole team does. But the dynamic and the charisma is just adorable to watch. Is that just organically found as the episode or the town hall is airing?
It is organically found. That's correct. It's somehow we've managed to mesh well together and work on answering questions for people. But yes, it's been a great time. We've had fun.
Do you have like quirky things that you do behind the scenes just to kind of bug each other, or? We won't go there. We won't go there. Okay, very good. Okay, so now we have a special thing today. Obviously, you have a lot of expertise, and so we're going to have a speed round of multiple questions about COVID-19, influenza, and vaccines in general. You ready?
I'm ready.
Okay, let's do this. Okay, we've heard the term twindemic. What does that mean? Can you explain it?
Twindemic means twins too, so COVID and influenza. The symptoms are very much the same when someone comes in and presents with fever, respiratory symptoms, shortness of breath, and we're coming into what is usually the biggest influenza season. And the great fear is, as they come together, there'll be an explosion. What's been interesting right now is we're supposed to be in a huge uphill rise of cases of influenza, and we've seen nothing. The numbers of cases of influenza reported by public health last week are in the single digits.
Wow.
So not what it's supposed to be at all. No one knows why, although there's some guesses. One of the obvious ones is that the main vectors, the things that transmit disease from person to person, are not in school. And so they're separated from their classmates with whom they share secretions, coughs, and the like, and so we're safe. Whether or not it's a good idea for them not to be in school is a different question, but from the twindemic standpoint, it looks like it's working.
I love it. The vectors. That's great. Okay, so now that we've talked about the twindemic, can you explain to us the similarities between influenza, the flu, and COVID-19?
Both are respiratory tract diseases. Both present with people having fevers, often with coughs, sometimes with upper respiratory, runny nose and the like, and myalgias, aching in the body. So that's all very similar. COVID, each has a little bit of a difference. COVID, in particular, is associated with loss in taste and smell, which never happens in influenza. But even if you have COVID, you can also get influenza at the same time, and we've seen patients here back in the spring who had both diseases simultaneously.
How does that present?
It presents just like either of them do, but it's important to think about in terms of treatment, because different treatments for each of the diseases.
Great. So would you say one is more infectious than the other, COVID versus flu?
Well, that's a hard question to completely answer. They're both very infectious. And they're infectious in the same ways, through respiratory, through people coughing, sneezing, putting it out in the environment, and then through you inhaling it and getting it into your mucous membranes, mouth and nose, where the infection comes. So they're both infectious in the same way. Protection against one is the same way as protecting against the other.
I'm glad you clarified that. So the physical distancing and the masks help with both.
That's correct.
Perfect. Backtracking. Vaccine. A lot of people are hesitant about getting the flu vaccine. Every year, this comes up. And there are some myths out there that you can get the flu when you get the flu vaccine. Can you talk about that a little bit?
Sure. Almost all the flu vaccines that exist right now are made of killed virus. They raise the virus up, they kill it, and then they inject it, and the proteins, the pieces of the virus that get injected, make your immune system turn on to prevent that kind of a disease. This is a killed virus. Well, viruses may or may not be alive, but it's an inactivated virus at the very least. Inactivated viruses mean they can't give you disease because they're dead. If there's such a thing as dead as virus, they're dead. So you cannot get the disease, influenza, from the vaccine. That is completely impossible. You may get some fevers as part of your immune system's reaction to the vaccine. You may get some muscle aches. So in that way, it seems similar to the disease, but it's not the disease. It's not an infection.
Great. So our immune system is reacting to getting the vaccine, and that's why we might feel a little sick, but this is just our body protecting us.
Correct. And many people think that probably if you get a little bit of fever, a little bit of muscle ache, that shows you're getting a good, enthusiastic immune response that will give you better protection later on.
Well, that's good to know. Does the flu vaccine help us in any way to protect us against COVID-19?
Oh, I wish it did,
know,
but the
right?
answer is no, not really.
We can hope.
But there is hope on the horizon for COVID-19, but flu vaccine is not that hope.
Not that hope. Okay, so let's talk about the COVID vaccine. Should you get the vaccine if you have already been exposed and have gotten COVID in the past?
Because we don't know very much about how long immunity lasts if you've had COVID before, and because it has been shown that at least some people who have had COVID have gone on to get a second round of disease later on, the answer is yes, it is recommended that everyone get the vaccine.
Okay, so is after getting the vaccination, is that permanent, or do we need to regularly get the vaccine?
Well, given the fact the vaccine has been released in the United States as an emergency use vaccine for approximately a day and a half, it's somewhat hard to know what permanent might mean because no one has been followed for years and years and years. It is thought, or there is a concern that it may be a vaccine where it gives you good immune system protection for a while, maybe 6 months, maybe a year, maybe a little more, but then the immunity will start to fall off. And so it may be that we're going to need to get updates in the vaccine on a yearly, every 2-year basis, but that's all hypothesis and in some ways related to experiments that happened with other vaccines against other related viruses in the past.
Thank you for clarifying that. How many vaccines do we have right now? And what are the differences between the vaccines from the different manufacturers? This is for COVID, obviously.
Sure. Well, right now in the United States, we have precisely one that's under an emergency use authorization. Worldwide, there are a number of vaccines, a large number actually, that are under development in one way or another. And they're of different types, at least several different general groups. There's some of the vaccines that are very traditional, that is, they take the virus, they inactivate it, and they inject it into people. Those vaccines are, for the most part, a little further behind in development because it's simply physically harder in the laboratory to get that sort of a vaccine together and get it tested. But there are a number of vaccines from a number of manufacturers in several other countries that are being developed in that way. There's some in which they take a piece of protein from the organism, the so-called spike protein, the thing that makes the organism look all spiky on the outside. And they take that piece of protein and they make that protein in the laboratory. They don't have to grow the virus, they just make the protein. And they make lots and lots of the protein and they purify that and they inject that protein into you, which is what some of the Chinese vaccines have been doing. Unfortunately, we have no large-scale data that has been published by the Chinese or even released to anyone to actually say how effective and what adverse effects there are particularly, but we know that kind of a vaccine is being used. A third type of vaccine is being used has been used for other vaccines as well, is they take that kind of a protein and they stick it into a different virus that doesn't really cause people to get sick. And then that virus is injected in people's bodies. It makes a lot of the protein before it dies, and the immune system sees the protein, and then it can react. That's the Russian vaccine that's being used, although there's no data, again, that's been released that people can look at. And there are problems in manufacturing that Russia is trying to deal with. Mm-hmm. The last type of vaccine is a vaccine where they use mRNA, messenger RNA, which is a little piece of genetic material that doesn't incorporate into the cell, but can be used to make proteins inside the body, so a lot of protein gets made and raises the immune system. The two vaccines that are or will be available in the United States are made of this mRNA vaccine, and that's the one that we have, the Pfizer and the Moderna vaccine.
Wow, great. And should we be worried about which vaccine we get from which manufacturer? Has that concern been brought up?
No, there's no data to combine them. So you pick whichever one you get and you go with it. Both the Pfizer and the Moderna, the ones that will be available early on in the United States, have very comparable response rates in people. So they're probably, for all intents and purposes, about the same. For people who are in a healthcare environment, we're likely to be able to get the Pfizer vaccine. The problem with that is that it's hard to store. It has to be stored at very, very cold temperatures. So our hospitals in DHS, other hospitals have that kind of cold storage. Pharmacies out in the community do not. The Moderna vaccine does not require cold storage like that, and so it probably will become more widespread in the community. But effectiveness, they're probably the same.
Would you sign up to get either one today if offered to you?
Well, we've already here at LA County signed up to get the Pfizer vaccine, which is going to be offered. The first round is going to be offered this week, and then as more supplies come on, which we're anticipating, other people will get it. So yes, I've signed up for the vaccine.
Great. So you've talked about people signing up to get the vaccine, and it sounds like there's going to be different stages of who's going to get it and when. What do you think is a realistic timeline when we can all hopefully be vaccinated?
If by all we mean people outside the medical community
Yes.
as well, it's probably going to be by mid-next year that we can see all of that done. There's a lot coming out of vaccine, although there's a lot of demand worldwide for the vaccine as well. If one were somewhat cynical about all the optimism that's going on, it is rare that things always go as planned. And there may be hiccups in manufacturing or distribution that are unanticipated. So it would be lovely to say within the next 3 or 4 months everyone will get the vaccine. That's hope, but it's probably not as realistic as saying by summer everyone should have an opportunity to have it.
Do you think that, and this is kind of a crystal ball type of question, but what do you think the world will look like between when people start getting the vaccine, which is right now, and when eventually it can be offered to everybody? What does the world look like in the interim?
Well, it's a very interesting question, and just as hard a question would be, what does the world look like after all that happens?
We haven't even gotten there.
but it probably in some ways won't look as different as it does right now in terms of the general principles of masks and social distancing. The vaccine does not give anyone 100% protection. So when I get it, and then I get my follow-up, because each of them requires a second shot, and we wait, let's say 2 weeks after the second shot when your protection has now peaked, I still wouldn't go out without a mask and without social distancing. It may give me 95% protection. So that's good, so that's much better than not. But
Right.
at the same time, that's not 100%. I still don't want to get COVID-19. So it'll be a while before we get to a point that we actually are able to change, to go back at least somewhat to what the world was like a long, long time ago. That is, maybe last March, what the world was like before. I think in the interim, we're going to be stuck with what we're doing right now.
Sure, that makes sense. What are any adverse or side effects that have been reported?
So the major side effects that have been reported are just like with the flu vaccine, pain in the arms, some fevers, maybe generalized muscle pains, and that's just the body's immune system reacting again to that. And that really was all that was reported in the large studies that were done. Everyone is well aware that since its release just a very brief time ago in the United Kingdom, which is the first place that the Pfizer vaccine was generally used, there were a very small number of patients who had history of allergies to many, many substances who got the vaccine and had a severe allergic reaction. Both of them recovered with therapy and did very, very well. So there is, but that's not actually a surprise. All vaccines have the possibility of an anaphylactic, that is, an allergic reaction to them. So, but that's all we know about for either of the two vaccines. For the vaccines that are being distributed in Russia and in China, both governments have said they've been given to hundreds of thousands of people and are very safe. There is no information yet available to actually verify that.
Great. We talked about the vectors earlier on. Now, the flu shot is offered to children. What
Yes.
about COVID-19? I mean, as of right now, it's not going to be given to children.
And there are two parts of that. One is children don't appear to be vectors of the disease. Adults seem to be very good at giving it to each other. That being said, the reason it's not being offered to children is in the push to get it out to the people who need it most. Children were not included in the trials. Not because researchers hate children, but it's harder to do trials with children. There's a lot more regulation, as there should be, involved with doing those sorts of trials. So there's no indication it's not safe in children. Undoubtedly, very soon, the drugs that we currently have will be going through trials in children, and we may see information coming out soon about that. But at the moment, since there's no information, it's not going to be offered in children.
Thank you for explaining that. Do you have any thoughts on what somebody can say, doctors, your colleagues, to individuals who are hesitant or say that they will not get the vaccine?
Well, it's very difficult. There are many people who are hesitant about many vaccines. And the best you can say is that the vaccine is safe, the disease is rampant and bad. And I think people don't realize, some people say, well, the mortality of COVID-19 isn't that high. It's about the same as a bad influenza season. And the answer is yes, although if you're the one that dies, then that's a bad mortality rate. And we have seen people who are old who have died. We have seen people who are young who have died. And so it's a bad thing. The second is, even if you don't die, there's a lot of information that many people who get COVID-19 have sequelae, problems that go on for weeks or months after they recover from their initial disease. Problems with fatigue, with muscle pains, with breathing that go on long after resolution. Why does that happen in some people than others? We don't know. We don't know how to predict it. But since you don't know if you're one of them, do you want to have that happen? And the last problem, of course, is if you don't get immunized, then you're not protecting not only yourself, but all of society. Because even if you don't get terribly sick, you can spread it to other people. I don't think any of us like living anymore, being cooped up, masks, being 6 feet away from everyone, all that's going on. We really need people to move forward so that we can get out. The last thing is, particularly right at this moment, when all of our hospital beds are full, not only in my hospital here, but throughout the county of Los Angeles and actually throughout most of the state of California, if you don't protect yourself and you get sick, you're going to go into the hospital and take up a bed for someone else who had a motor vehicle collision and now is ill. Right now, there are not enough ICU beds for people who are sick from other things than COVID. So really, you're acting to protect others, not just yourself.
Thank you for explaining that so clearly. And we asked you a lot of questions. I'm sure there are more questions that we didn't ask or that we haven't discussed. But we'll thank you for participating in these lightning round questions of COVID. You speak so eloquently, and offline we were talking about your history in theater. Can you tell us a little bit about yourself in that regard?
Well, I've dabbled, if you will, in amateur theater for a while and always enjoyed it. Although being a professor at a medical school forces you to be a tad bit theatric if you want to keep the students' attentions. Over the years, it's been hard to compete with various things. Now you have to compete with them checking Facebook, or not Facebook is so old-fashioned, Instagram or TikTok during the lecture. So you want to keep them engaged in some way.
Well, we prepared a Shakespearean quote for you. It's sitting in front of you. Do you think in that your most beautiful voice, if you could read it for us?
To vaccinate or not to vaccinate? That's not really a question.
Thank you, Dr. Holtom. That was beautifully said. Now, we talked about not having to be in such isolation. What do you think you are looking forward to, or what you might do when things go back to, quote, normal again?
I think the first thing I'm going to do is grab my grandkids and all go to Disneyland.
Such a good answer. I'm so glad you said that. All right, let's talk about Disneyland. What ride are you looking forward to the most?
Oh, that's such a difficult question.
I know.
Loving Disneyland so much, my favorite ride still remains Indiana Jones.
Such a good ride. Such a good ride. Do you like the purple, the blue, or the yellow door?
Well, actually, over the last few years, it's been
know.
broken and you only
I
go
know,
through the
I
yellow
know,
door,
I
but
know.
still, we'll pretend that that part of the ride still works, and we'll go for the future.
The future, the purple door it is. Very good. It's interesting. If you go to the future, let us know what it looks like.
Absolutely. Hopefully it'll look like everyone walking around without masks and being 6 feet isolated.
Perfect. So as we wrap up here, can you share with us something memorable or inspiring from this unprecedented time?
Well, it's been such an unprecedented time and so long, it's just very hard to think. It's only been 9 months, really, since all of this started, because it's sometimes hard to think back how life might have been then. I think the most memorable thing is not a single incident, but just every day looking around throughout the hospital at all of the staff who are stepping up every day in very difficult circumstances when everyone is so tired of all of the things that we need to do, and step up to continue each day to care for our patients. It's just inspiring to see everyone working together in a situation that we've never been in.
Thank you, Dr. Holtom, and we appreciate everything that you do.
Thank you so much. It's been a pleasure talking with you.
You too. Thank you for tuning in today. Make sure to follow us on Instagram and Twitter, and to subscribe to the LAC+USC Medical Center YouTube channel, where you can find all of our previous episodes, in addition to the episodes located on anchor.fm/House Calls with Dr. K. We also want to hear from you, so email us at lacuscpio@dhs.lacounty.gov. Thank you for tuning in, and see you next week.